This workshop will not be as Down syndrome, it will be away. It is our life, it is the communication. So we will speak about communication. We need it not to be a physician, but to be a human, to go from day-to-day life, and it is very important to go to this point, but we are concentrating in the medical field in this lecture. We try, of course, communication need hours and hours, but we will go through it. If we learn 1 or 2 points, it will be good. So you will be with me. Don't speak with your others, with your colleagues. So effective communication skill for physician, that it is a technical aspect. As we speak yesterday, that the physician has skills, examination, knowledge, surgeon, or. But the technical, the non-technical is the communication, how to go between you and the patient, the family. It is, as we said, value and goals. Good communication is basic component in our good clinical care. Without of each, it will be just technical, and the machine can do this. So the difference between machine and human is communication. So in our life, we take that who is the doctor, the best doctor. It is not the best knowledge. That the knowledge will be in the lab. Maybe he is better than the physician who will be in touch with the patient. So if we are looking for effective communication, that is the patient, relative, senior colleague, and junior colleague. It is not just the patient alone. So it is a team. It is a group what we are going through them. And the aim from this lecture to improve the surface and confidence of doctor working with diverse range of people. And so this is, you are speaking not for language, but even education and others. So what we are trying to achieve, it is very important. What behavior will we use and expect, and how successful we are in doing all these things. So it is if we are developing baseline for communication, it is in our life from birth till we die, we are in continuing communication. There is many problem and many barrier in front of us. We are trying to adjust it. It is not the barrier would adjust themselves. We are the one who will adjust to improve our communication. And it means sharing. Communication is Latin word, and that it means sharing. And as we said, communication, it is not from today, it is from life, and we are building up the communication and communication skill, improving from time to time. So it is very important to say that communication, it is, as some of us understand it, that it is language. No. If a patient or relative came with bad smell, it will broke the communication. So even smelling, nobody feels that smelling will affect communication. No. So we are using our 5 skills, which is hearing, taste, smell, touch, blah, 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 blah. So what is communication? It is message. So the message comes from one to the other, from one to group, from a group to one. So this communication, this is what we are speaking about and say. So it is the most important, which we will go through it. It is what? It is message. Can you repeat with me? It is message. It is not information. It is a message. So this communication, as we said, that to start from birth, and we know as neonatologist or pediatrician that the baby after birth directly will look for the round face for the mother. So this is the first thing which we look for it, or we discover it. He didn't know the details of the face, but he is looking for a round face. It is the mother. So this is the first thing he look for it in the life, and will continue by bubbling. And when he see the mother, he will smile. So this smile is a message. He cannot speak, but the smiling is a message. So as we said, it is starting from early in the life and continue. Okay, these communication skills, is it genetics? Is it cultural? Is it training? Let us go. Did these people, there is a three person in front of us, one Bedouin and the other is farmer and the fisherman. Are they different in their communication, and why?
Which people they are around you.
Okay.
So, and this is like example, if we took like Einstein's son and we put him in the desert, he will react like a Bedouin.
Exactly. So the culture will give you the reaction, how calm he will be, how the habit, how he say. If we look to the genetic, how the father and the mother do. So in the Bedouin or the desert, they are harsh. So what they will do is harsh. And even their belief or their word will be different. Okay. There is one poet who was going to Baghdad, to Harun al-Rashid, and he was giving a poem, and he said, أنت كالتيس في مقارعة الخطوب. So if we said this word, I know it is Arabic, but I will continue it. He said, you are like a goat. Okay, he's saying to the king, you are like the goat. He is a Bedouin, and he said that it is what the habit which he was on. And they said, what is this bad words you are saying? He said, this is his habit. This is what he learned. This is his communication. This is the best he has it. They keep him for 6 months in the farms and in the castle and so on. And he returned. It was a different issue. So it is genetic, it is cultural, and it is training. So as we train, we can change. So as we said, it is a skill. It is not just knowledge. So when we said a skill, there is something inside you, you will build in it. As we speak yesterday, that the skill can be improved by training and teaching. And it can be modified. For example, if I am an artist, I have something inside me. If I go to training, I will be better. Better in choosing the color, better in viewing, understanding the light and the dam and so on. So it is a skill, but the skill can be changed at least. When we're speaking about communication, it is like this game. The message is like the ball, and there is the sender and receiver. There is it is two ways. It is not one way. It is very important to understand this. It is two ways, sender and receiver. In the point, you will be the sender, the other side will be the receiver, and it will go on like this ball. So, who is the responsible person in this game? If we have two persons, coach and trainer. Dr. Manal, she said here is the coach. So there is one who is the responsible, both is responsible, but both responsible that the ball will go out. But the most of the responsibility is in the coach, not in training. The trainer is come to train. If he become trained, he will not be a trainer. So you understand? So this is the ball. We didn't like the ball to go down the ground. what are the cause for this game to fail? I will give you one cause just to change your mind. They are playing the game at night without light. Do you think the game will succeed? The weather.
Environmental change in the
Said environment, light, and weather. You know that the coach came with jalabiya and will game play tennis? Do you suspect this? So let us say clothes. So as we said, it is a message, successful message between two persons or more, and this to be in the same place, and there is factors will go through it. So if we said, what is this factor, we will go to
speed. The start.
wrong.
Environment.
Wrong.
Distance.
No, I need one.
The distance.
Wrong.
The distance.
The ball.
You see where is your defect? You see that you are defect in communication. Why? Do you understand the subject? The most important factor is listening. We are not listening. We are doing everything, but we keep listening out. Then we will go through it. So as we say, listening. If you didn't listen to the coach, he said to you, right, you will go to left. He said to you, right. So he will send the ball to the right side, but you didn't hear it. So you will not go to the right direction. So this is the important thing. So if we go to the group of communication, and we were speaking about it, as we said, that the center of our communication is listening, okay? We will go quickly through the environment, and we see the environment, for example, we'll go for all of them, and everybody is speaking about body language, body language, body language. This is also, we'll speak about that most, not our most important. So listening is for understanding, communication for commitment. Can you have this message? Listening is for understanding, and communication is for commitment. So this is the message which we will send today, is listening is for understanding. So if we speak about environment, so environment is big spectrum. And if we see that what we are doing in communication, and can also this give us how environment affect, okay, the communication. Why they do Down syndrome make their conference here in Shangri-La? Do you understand why? Why they didn't put it in Al Khor garden, for example? It's free of charge in the daytime, okay? And they do it there, and that is it. Because they are sending a message or messages, okay, to have improving your communication in our lecture. You understand what I'm speaking about? The space, the place, the clothes. So if we go and we are walking in the street and we see these people, these 5 people in front of us, do you have understand these people? Who are they? Did their clothes give you a message? Yes. When you see a girl with her special clothes for nursing, directly in your mind, this is a nurse, as we said in Arabic, Malak Rahmah. So her job, I didn't know her name, it is not important, but the message which come to me is the communication has been sent that she is a nurse. If a policeman came, my attitude as a human being will be different than if I see a nurse. Maybe if I see a beautiful nurse, I will smile. But when I see a policeman, even if he is beautiful, I will not smile. I will be afraid. So it is a message. So even the clothes is a message. So if we see some person with clothes, Bedouin clothes, he send message. And to send it to whom? If this gentleman with the Arabian clothes, American see him, what he will say? Bedouin. And this equal to stupid, blah, 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 blah. But when I see the clothes as Arabic or Saudi or so on, I will classify the clothes. Is it prince clothes or Bedouin with the camel clothes? They are different. So it is a message. So even in communication, clothes can give you idea. Is that person in front of me is good, bad? Even if we say that clothes can change the face and the percept of the other. Is he beautiful or not beautiful, or good or bad, and so on. So person, clothes, and uniform can make a different change. Okay, so as we speak, if we do the lecture different, and we see that we are choosing good space, good light, good color, no noise. So if the cars is coming here and beep, 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 and there is many noises come to the side, nobody in this conference will hear what happened. So communication between the lecturer and the other will be not present. So always to have a meeting with somebody, you will choose a good hotel, no noise, and so on. So space and the other is very important. We'll go to a next point, which is very important, is distant. Is distant affect communication? And the second question, are there types of distant? Can anybody help?
Okay. Yeah, I think it affects. But
Can affect. Do you know distant, difference between distant or type of distant?
not really, but I think even the tone affects, not only the
No,
distance.
tone is not different, and this is another subject. You speak this about distant.
Maybe for me, distance is nothing. It doesn't
Okay.
affect.
Anybody know anything about distant, type of distant?
I know there's a social distance between two people when they are talking. So when they talk, when they communicate with each other, should not be very close. There should be like a social distance. There is, I think, 1 meter, something like that, or less.
And I'm speaking
And-
about,
and-
are there effects?
Yes, it does
The
make a
distance
difference.
can affect.
Yes.
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 So the one who is semi-sleeping in the end of this lecture is different than you. I'm right?
Right, yeah.
So there is more than one distance. So we will go to teach us our the people here about distance. There is 5 types of distance. Okay? We will go through these 5 types simply. The first, what they called it, the special area. You know what is special area? You know what is special area? Not everybody will go through. And what is that special area? It is this distance. You see? How many centimeter this one? It is 45 centimeter. So in this surrounding, which is 45, I will not accept anyone in this room to come for this distance except my daughter. Okay? So anybody, she will kill him. So don't come in this area. So this is, they called it social. And this is the family. Why? It is only for these people. Because it is not speak or language. It is the breath. It is the heartbeat. Okay? We can feel it. So it is small distance, and it is between 15 and 45 centimeter, and this is a special. The other one is the personal. It is more than the special, it is 1 meter. So in this area, also not everybody to go inside it. It is for the friends, it is for colleague, but not patient. So a patient, when he come in this, it is a problem, because it will be illegal, as we said, okay? So even that speaking about this distance, is it male or female, okay? So we're not speaking about this. And in this area, there is a good eye-to-eye contact, and it is more social. So not everybody will go. The other one is the social area, and between 120 centimeter and 360. Okay, so this is, they called it social. So the one who is sitting there more than 4 meters, he will not, if there is no microphone, he will not hear me. But with microphone, he cannot see me well. Okay, so it is social, but if he go out this side, this area, it is a problem to see. There is no eye-to-eye contact in that distance. But here, there is eye-to-eye contact, and when we are speaking about eye-to-eye contact, we will understand what is it. So more than 3.5 meters, this is a general area. It is for public, general lecture, and so on. So the communication in it is less. So this is, we finished the distance, so it is important to understand it in your preparation to do a lecture or to do something else. The start is very important. If you start right, it will be good. And the start have many faces. So if we come together and we said, good morning, it is different than good morning. Okay, so how we start and the different between person and person, male and female, and so on. So the start is very important. Always we are speaking about language. Language, is it a speech? It is not the speech. What we say is not nearly as important and as how we say it. You understand that? We will repeat it again. It's very important. So what we say is different. So if we see words, it is different about how we do it and what is the message we are sending. So there is, what we said is in language, there is 3 things: verbal and non-verbal or body language and tone of voice. Which one is more important in these, verbal, non-verbal, and tone of voice? And how much percentage you can give them?
Maybe
Yes?
the tone of voice.
What's that?
The tone of voice.
Tone of voice is more important. Good. Not the verbal, not how percent you give? How much percentage?
70.
70? Okay, can we see another person? Another idea? You can see it. Verbal can give us only 7%. I mean, you speak by Tagalog or by Indian or by English or French, language is 7%. Tone of voice is around 40% and body language is 55%. So you understand now what is the meaning of body language and how it will affect communication. Tone of voice, how much, and the language per se is how much. What you hear, it is 40% of message, okay? What you see or feel is 50% of message. So feeling, even when we are looking for facial expression, dressing, posture, but the word per se, or the language, the word per se, it is only less than 10%. So when we are speaking about tone of voice, is it how? High, low, smooth, and anger. When we are in our car and we see what they called it, not a movie, but there is Tamthiliya, what is it? Tamthiliya, a show. but not a show to see it, but a show in the radio. Okay? Some you can feel the anger, you feel the happiness, you feel everything. It is like you see it by your eye, and it is by hearing. So how can we do it? So verbal is not that most important, but it is important to understand because it is the baseline of our communication. So how to make the verbal language effective is the most important, is to make it simple and non-technical. So this is very important. When you speak to the other, don't go too deep or technical. If a patient came and you speak with the medical language, he will not understand. So try to make it simple as the most important thing. When you make communication with the other, don't look for his education. And this is very important. You will not say, this is a pharmacist, so I will not give him that information. No. When you are giving information as a physician or technical, or give them the communication, the words, it is like the other, simple as possible. So, even if you are interviewing, I will not go quickly in this subject, are there type of a question? Is the question is the same? Can you give the microphone there? How it will affect communication? Mike, please, here.
Yes, I think that they cannot ask like private questions during interviewing.
What's that?
Yani, for example, the interviewer shouldn't ask private questions.
Bad? Okay.
Right?
Do you know the type of question?
Yeah, things should be related to...
There is another microphone, but yalla. Yes.
Yeah, we have closed-ended and open-ended questions.
Exactly. What is again, can you say it?
Yes, for example, like open-ended, like, how do you feel today? Like he's
Okay.
going to say, I feel happy. He's going to elaborate his feelings. Why do you feel sad today? He's going to just say no.
Yes.
This is a closed-ended question.
Exactly. So there is many types. It is not just these two type of a question, but there is many type of a question. The most important is what is the type you are using. If you are using open question, okay, you will have the answer or more than one answer. If you are speaking about direct question, how old are you? He will answer one question. Okay, 29, full stop. So there is no choose. So sometimes you will have to have. But as a patient, when you ask them or other side, the best thing is to give them the open question, direct question, where, how, and when. Supportive question, is this will help you? Okay? This is not type of a question truly, but it is what they call supportive question. Informative question, it is like direct question. Complex question, there is many types of complex. Sometimes it is what we call the leading question. Do you feel the pain in your ankle or knee? He was said this. He didn't have pain neither in his ankle and his knee. But because you are a physician, he cannot say no, neither this or this. He will choose one and put it. Do you believe this? Okay, so it is important to understand how to make it. And sometimes making complication question. Leading question, as we said, you are asking them, do you need an answer to be going with your question? And this is a common in medical field. An explicit question, sometimes you ask something which is not good, which will make the patient anger, so don't ask it. Eye language. إن العيون التي في طرفها حوار. So, when you look for somebody, what that mean? Eye-to-eye contact, what that mean? Is it a language? Yes, it is a language. So, Why it is a language? Can you give it to it? Why it is a language?
It shows respect, attention.
What's that?
Attention, respect.
Attention,
Respect as well.
respect,
Yeah.
okay.
And it can show some expression of what is inside.
Expression. What do you mean by expression?
It reflects the emotions. Yeah.
المثل المصري يقول اوريك العين الحمراء، ايش معناها؟ When you look for somebody, you give him an order. Okay? So if I said she was playing a game and I give her an eye, what she will say, she will be afraid because I look for her, she do something bad. Okay? Or it is an order. It is I just see her, look for her. But why she is taking a message? So they said that the eye is the window of the person. So if you look for his eye, make a good eye-to-eye contact, you will go inside and know what is his inside. And they said that it is the timing. When I'm doing the lecture, I'm looking for 3 or 4 of the person who is sitting here. Even one of them was looking and dreaming and so on. I kept her awake. If we go and ask her, she will answer, yes, I was going in my dream, but now eye-to-eye contact keep me in the area. So it is even in the lecture. So when I do the lecture, I'm looking for this lady, eye-to-eye contact, I understand that my lecture is going to reach to her. Is it going good or bad? Okay, so even the other in the back, they are looking for me now, I'm looking for them, so there is communication. So this is what we're speaking about, eye-to-eye contact and its effect. Okay. Are the window to the mind, and this is what we're speaking about. So we go again, it is the eye-to-eye contact, it is not just a looking, it is listening, order, agreement, disagreement, fear, and love. So do you feel that these 6 things go in one side? Tonight, when you are going, look for your friend, look for the other, and see how the eye-to-eye contact give you an information and communication. There was many study and give you the percentage of time that communication is going, how much for the listener and how much for the speaker, and these things, how it go and how you will concentrate or make the other side what you are trying to give him the message. I will go to how to improve. This is my daughter a long time ago. How old now? 13. So 13 years. Okay. So we finished body language, and did we finish body language or just the eye-to-eye contact? This is body language. Mona Lisa. Do you believe that the what they said, strange smile, or because the French people, they said it is strange? Do you feel that it is truly, there is something in this picture? It is an idea. So when we look for the other, we look for something. Okay. Here, there is either a smile or there is no smile, but if we look for these people and jump for them, what they say. So each shoot give you an expression. So choose what your expression in each of this picture. So one fair, one smiling, one. So just the body language is different and give. But what they called it, the gesture is different. And if we see the gesture between different country, okay, what these, I will not go and read it, what these 3 people gesture, do you believe it is not? What do you think? Because the Japanese is different than Iranian and the French. And we think they their gesture mean different in different country. So if somebody says something or do something, don't take the picture bad for you. Maybe in their country it is good, but even the body language is used. I cannot hear, listen, or speak. It is good. So each part of the body has its language, okay? And if we look for the face itself, each part of the face have his message, okay, or language. We will go quickly in this part to see if these people, it is the same face, the person, but if we look why we express, because the forehead is wrinkled, so this is mean bad thing or not good. If the face is smiling, this is good. And the difference between even smiling, is it big, small, and so there is many just in one face. And this lady give you the picture in different condition. If we look for the eye itself, it is not the eye-to-eye contact, but the eye itself, it is a picture. And we look, we can say this is smiling, this is happy, this is surprised, this is, so just from each area in the body we can say there is a message. Even if we are taking just the lips and the area and the cheek and so on, even the titling of the body, if we are looking to the side, if we are increasing, decreasing, looking down, and they said don't look down. Don't look down because the expression is not good. So when we have a meeting or we have somebody in front of us, it is giving us a message. But if we go to United States and see somebody putting his foot in the chair, okay, this is normal. But if we see it in our country or United Kingdom, this is bad thing. So it is different in the area. So, but usually the position, the human position, give you feedback about these people. So even using the part of the body, especially hands, will give you messages from here and here. Always this girl in front of me, day and night, but still I love her. So if we go back to the most important thing which we keep it, okay, is listening. So to do a communication, it is listening. How to prove that listening is important? So God gave us 2 ears. Even if one is blocked, the other will be opened. Okay? But we are still speaking with this big tongue.
But with the women, we have 2 ears and 1 tongue, but we are able to use our tongue more than
yes, this is what we are speaking. So hearing is a passive. Hearing is a passive and mechanical. But listening, this is very important to differentiate between hearing and listening. So I didn't speaking about hearing. I'm speaking about listening. Even the deaf, okay, can listen, but not hear. You understand what I mean? Yeah. So listening is different than hearing, okay? So it is not just a mechanical, it is mental. So listening is mental and active, but hearing is a passive. See, hearing mean, when we say that listening is hearing plus understanding. So it is most important that just to learn how to wait till the other finish to, so you will have listening. There is one study they said that in our life, 70% of our time in life is awake. For example, they said 70% reading, 14% writing, 16% speaking, and listening 53%. 50% we are listening. In the radio, in the car, TV, telephone, and so on. 20% for them is direct and 32% is indirect. So from the communication, from the TV, from anything. Do we remember last time you listened to somebody? Yes? Always you are speaking, and very rare you are listening. So if we have a message from this workshop is important of listening, how to wait to be listening. So the factor which affect listening is very big, like pollution, attending, understanding, memorizing, reaction, progression, and result. I will not go through all of them because of time, but I will go quickly to see about pollution. It is something inside us. Did we need to read it or not? Attention is ready, mind and body, to understand what the other speak about it. What you are looking here? Can we see somebody will say what is in front of us? What can he see? So everybody is looking for something, looking from his view, not for general view. So it is very important to wait, understand what you look for and what is in front of you. So what are the factors leading to is, if we're looking for listen fair, how much time still for me? So if we are listening, why? Again, listening failure, okay? And we have this list of listening failure. Can you give to this lady again? What is the most important cause of listening failure from this 10? We are looking for listening failure, okay? What is the common cause of, the most important cause of listening failure? Yes, ma'am?
Waiting his turn to speak.
Waiting his turn to speak,
Yeah.
yes.
Daydreaming.
Can you give her the prize, please?
Hello.
Who said that? Can you give her something? Yes. This is our problem, okay? So we are looking for many, many causes. But if we look in real life, we are looking at waiting his turn to speak. Sometimes they are just thinking, if he is good and try to concentrate, he will write it, like in lecture. But somebody in the lecture and waiting to ask the question, he will not understand the rest of the lecture. But the clever one will write his question in a paper and forget it till the lecturer finished and the time for question came. Do you find this is interest? Okay, so this is the cause of listening failure. Okay, so waiting for his time to speak. Oh, again. And there is many personal effect. Nobody speak. How long you will have? ها؟ كثير نص ساعة. لا خلاص بسرعة. So we are looking for personal factors, okay, affecting communication. Number one personal factor is anger. If you are angry, you will not listen, you will not understand, you will not communicate. You will fight, and that is it. So if you are angry, don't go away, sit alone, take your breath, take a cup of water. Then second is anger. What is the third? Anger also. So anger is most communication subject. Ignorance of the other, this is the second thing. Ignorance, if you are not looking for the other as a person, you will communicate with him. If there is something in your mind, you will not communicate with the other. Okay? If you are doing it to your personal and so on. Discommunication is by interruption. If there is somebody making the interruption, the communication will fail. And it is personal. If you are speak to yourself, okay, not just the language, but even with body language and eye-to-eye contact, nobody will hear you. So if nobody listen to you, it is personal from one side and from the other side, and this will interrupt communication. If you are in the clinic, especially in medical field, and you make joke with the patient, the communication is interrupted, or it will be bad, okay? So always don't make joke with your patient or your client if you are in business, because there is a limit. There is a communication, there is understanding of levels and so on between these two persons. So this will, if you make a joke, you will make a problem. Take home message is good communication is basic component of good clinical care. Communication is an interaction. It is not one person. It is an interaction, sharing of information, and good communication achieved by using our 5 senses. And listening is the most important factor in interpersonal communication, and verbal language is the weakest factor in communication, affected by body language and tone of voice. And lastly, anger is the most important factor affecting communication. And this is my reference. Thank you for you.